As we come towards the end of the year 2020, I requested you to send your questions via our WhatsApp number. And I'm so excited today that there are several questions you guys sent. And today, I am going to answer some of them. Please don't go away, because even if you did not ask, yours may be part of today's video. Watch.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private consultation, go to my website www.drothman.com and make an appointment. We shall be in touch. And if you'd like to also get in touch with us on all our social media platforms, we shall be there to answer you. All our social media platforms are Ask Dr. Othman. This time around, we said we are ending the year 2020, and I requested you to send questions via a video onto our WhatsApp number. And I am happy that several of you sent various questions, which we are going to answer. I know time will not be good for us, so we shall answer a few of them. Let's start with Mr. Okello from Kampala.
Yes, doctor. I'm Ambrose Okello. I'm in Kampala. Yes, doctor, I want to know. My wife always said she has a lot of pain on her abdomen and the waist when we have sex. I don't know what would be the problem. May you let me know? God bless you.
So, Ambrose Okello is asking about pain during sexual intercourse, that his wife feels pain while they are having sexual intercourse. I would vividly say that this is likely to be a PID or a UTI. Actually, in one of my previous videos, I discussed about PIDs. PIDs are pelvic inflammatory diseases. What are these diseases? These are a group of diseases that affect, or a group of infections that affect the pelvic tract. In the pelvic tract, we have the V, we have the uterus, we have the fallopian tubes, and the ovaries. So if these parts, if any of those parts, all of them are affected by an infection or any inflammation of a certain kind, the woman will feel pain during sexual intercourse. Actually, PIDs, this is one of the main characteristics or main features. It's actually like a stigmata of PIDs. Feeling pain during sexual intercourse is what we call dyspareunia. So, what I would advise Mr. Ambrose and others out there who get pain during sexual intercourse is that you should go to the hospital and get an evaluation. What do we do there? Actually, this pain can also be elicited when you go for an examination. The VE examination done by the doctor will elicit pain, and that is what we call cervical motion tenderness. Why are you having this tenderness? Tenderness means pain. If the doctor puts the two fingers inside, I think most of you have ever gone to the hospital and then your doctor puts the two fingers into your V. So when you put the two fingers into someone's V, you'll be able to touch or stimulate the cervix. And because the cervix is inflamed, because the cervix is already infected, or any of the structures there in the pelvic region is infected, then the person will feel pain, which is the same thing that happens during sexual intercourse. Therefore, pain during sexual intercourse is a sign of a PID. It can also be a sign of a UTI. We also talked about UTIs. We said UTIs are urinary tract infections. These ones affect the urinary tree, and that is the ureters, the bladder, and the kidneys. If those parts are affected, then someone can also feel pain during sexual intercourse. So if it's a PID, what are you going to do? What you need to do, like I've said, you need to go to the hospital and we confirm. They confirm that it is a PID. They may do some other tests like the V swab and other tests, the CBCs and so on, to confirm the cause of this infection. Mainly the causes are chlamydia of this word, trichomoniasis and so on. So once the cause is identified, you can easily get treatment. Ranging from orals or from the tablets up the injections. Actually, if it's chlamydia, it's very simple to treat. You just take capsules of doxycycline. Doxycycline capsules come in 100 milligrams, and therefore someone will be taking 1 times 2 for at least 2 weeks, and chlamydia will go away. Your wife will not be feeling pain anymore when they are having sexual intercourse. And if it's the other stuff, the trichomoniasis, metronidazole, or what most of you call fragile will clear it away. So what you need to do is to go to the hospital. We confirm that it is a PID or it's a UTI. You get treatment and pain will end there.
Good afternoon, doctor. My name is Irregular. I have a problem. Last year I had a child. Unfortunately, she died this year in September. So my husband asked me we should start trying again. But my problem is my cycle keeps on changing. In October I had 27 days cycle, and then in November it changed to 31 days, and whenever I'm about to have my period I have pains in my legs. And for this monthly I'm expecting my period to be on the 25th or 26th of this month, and I'm having my period pains, and my legs have already started paining. So please, your advice will be highly appreciated.
Okay, so when we look at Harriet Olungo, she's asking about irregular periods, and we discussed about this issue last time, and I will still reiterate that having an irregular menstrual cycle or irregular periods should not be a problem for fertility. Actually, people with irregular menstrual cycles get pregnant very well. They have no problem with conception. What you need to do if you want to target your fertile days or your ovulation days, use the shortest. We said use the shortest length of your menstrual cycle. Now, looking at what you've given us, 27 is like the shortest cycle, is your shortest cycle. Therefore, we are going to use 27 to calculate for you the ovulation day when you can have or when you can target to have sexual intercourse with your husband, and also calculate for you the fertile days, that window where there are chances of conception. Therefore, if you have 27 days, it means that from the 8th day up to the 18th day, you are fertile. 8th to the 18th day, that is day 8 to day 18, you are fertile, and therefore, during that period, you can conceive. And then, on the 13th day, for you, if you have 27 days, your ovulation day will not be the 14th day. This time around, it is going to be the 13th day. And if you are to get any day that is best, that is suitable for you to conceive, where you have higher chances, is the 13th day. I get your understanding, Harriet, and all those of you who have a 27 days cycle. And then the second point of feeling pain, the leg pain during menstruation. We also discussed about this, Harriet, and we said that many women feel pain during their menstruation, and this should not be a problem, especially if this pain started long time ago, like when you are having menarche, or when you are beginning your menstruation during that time of 13 years, 14 years. If this pain has been there throughout, then it shouldn't be a big problem, because that is what we call primary dysmenorrhea. We say the primary dysmenorrhea is that pain is when a woman feels pain while having their menstruation, but it started as early as their menstruation started. But those people who have pains after, like when you are still young, you never experienced periodic pain. But during adulthood, you experience periodic pain. Then that is called secondary dysmenorrhea. And that is where there are strings attached. That is where investigations are supposed to be carried out to find out the cause. Because it may be adenomyosis, endometriosis, PIDs, and so on. We said with secondary dysmenorrhea, there is a pathology, there is a known disease. This woman has a problem within her organs, the pelvic organs. But with primary dysmenorrhea, there is no pathology at all. There is no problem with your pelvic organs. What is the problem in primary dysmenorrhea? We said that this person secretes a lot of high levels of prostaglandins. And we said that prostaglandins are very important. These are body chemicals that actually help a woman during labor to provide contractions to propel the baby to get out during parturition. So now these women produce or secrete a lot of prostaglandins during their menstrual periods. And now because there is a lot of prostaglandins secreted, it increases or it brings about uterine contractions. And now when there is uterine contraction, then the muscles of the uterus will compress or will constrict the blood vessels. When the blood vessels are constricted, there is denial of oxygen, there is restriction or reduced supply of oxygen to the muscles. And when the muscles are denied of oxygen, or if oxygen supply is reduced, the muscles will start aching and the person will feel the pain. Now, let us ask ourselves, why the pain in the legs, yet the activities are happening in the pelvic, in the abdomen? That is what we call referred pain, or what we call radiation of pain. Why is the pain radiating to the legs, or why is it being referred to the legs? Remember that these pelvic organs have nervous supplies. Nerves, they are like one of the tubes that allow someone to sense pain and sense some other things which I'm not going to talk about. But in this case, these nerves, the nerves that supply the pelvic regions, also supply the leg, also supply the thighs, also supply the feet. So you'll find that there is a shared nervous supply between the pelvic organs, or the endometrium, or the uterus, and then the legs. Therefore, when that period comes, when you have period pain, it will also be referred to the legs, and you feel pain in the legs during your menstruation. It shouldn't be a worry. You should understand that that is dysmenorrhea. And if it is a primary dysmenorrhea, my friend, you have nothing much to do. If it's a secondary dysmenorrhea, you need to do investigations, carry out scans, do various tests to confirm the cause. Primary dysmenorrhea, nothing much you need to do. It's only taking medicines. And I talked about this, that you can take painkillers. You can take NSAIDs, the non-steroid anti-inflammatory drugs, like diclofenac, ibuprofen. We said ibuprofen is one of the best as far as this is concerned. We talked about celecoxib and other painkillers. And we said that when the pain persists and it goes higher, then you go to the hospital. We can increase the analgesic ladder. We also said that there are some home remedies you can do, like taking warm water, drinking warm water, or getting a bottle, you put warm water and then you put it on your belly. Then also having those positions we demonstrated in the other video that can reduce that pain. Therefore, that pain should not be a worry for you. Let's have another video.
Hello, Dr. Othman. My name is Gostan and I'm from Nigeria. I have a question. The question I have is, one, can hemorrhagic ovarian cyst cause an infertility in women? Cysts that have 6 centimeters. And second, can hemorrhagic ovarian cyst make a woman not to see her ovulation, or make a woman not to ovulate? Thank you. I'll be happy if you give me a feedback.
Thank you to Constantine. Can a hemorrhagic cyst cause infertility? And can a hemorrhagic cyst cause a woman not ovulate? This hemorrhagic cyst is 6 centimeters. Now, in one of my previous videos, I discussed about ovarian cysts. And my answer here would be a yes and a no. Yes, how? If this cyst gets large enough, for example, especially if it goes beyond that 6 centimeters you're talking about, and it compresses the fallopian tubes and all the ovary, then we can have an issue of infertility. Secondly, if this cyst gets infected, if it gets infected and you get a PID, which is a pelvic inflammatory disease, then there is a likelihood of getting infertility. How? because a PID, if not well treated, can cause scarring of the fallopian tubes. And when fallopian tubes develop scars, then chances of infertility become high. However, looking at this ovarian cyst, like in one of my previous videos, I said this is one of the indications of a surgery, what we call cystectomy. Actually, once someone has a hemorrhagic cyst, then surgery is indicated there. Because when we're talking about the other cysts, the other ovarian cysts, we said looking at the size, you can take medicines, you can take antibiotics, and then the cyst can go away, especially if the cyst is below 5 centimeters, if it's still small. However, with a hemorrhagic cyst, by a hemorrhagic cyst, we are talking about, my colleagues are talking about a bleeding cyst, a cyst which is containing blood. We said a cyst is like a polythene bag. It's like a balloon filled with fluids. But now this time, the fluids, all the water in this balloon, in this polythene bag is blood. Which means there is a bleeding process which is going on in the pelvic region. This cyst will now require an operation we call cystectomy. And once the cystectomy is done, then the person can gain their fertility. You can produce, you can conceive and produce any number of children you want. And even if the surgery is not very successful, because at times when you go in for cystectomy, at times you can take the whole ovary, or you take the fallopian tube, you can cut it. So even if that fallopian tube is cut or one ovary is cut, then the other ovary can still function and someone can still conceive. Therefore, I would conclude and say that an ovarian cyst can cause infertility, but if well handled, infertility is not a problem with a hemorrhagic ovarian cyst. And as far as ovulation is concerned, no way. If, like we've talked about it, if everything goes on well, then there is nothing that can stop someone from menstruating, nothing can stop someone from having ovulation. Let's look at another video.
Hi, Dr. Othman. I'm called Gloria. I'm from Uganda. Right now I'm in Dubai. But my question today is, I have vaginal discharge. I have something white coming from me every day. But when I'm say like 3 days to my periods, it doesn't come. But I'm so scared about it. I not taking medicine and antifungal bacteria, but it didn't work. Nakozesa zino waliwo zino empanvu ez'okwesonsekayo, it doesn't work. Waliwo n'endala ze bampa n'emmira bumizi nga bikana ku mmira emu nazo bazita antibacterial, something like that, nazo tezakola. So I'm so scared because the things are not changing and it's coming every day. Every day I saw it in my neck. I'm so scared. I thought
Oh, sorry about that, Gloria, about the vaginal discharges. But let's understand this very well. Vaginal discharges are mainly caused by 4 diseases, or what we call 4 infections. And number one of them is chlamydia. Number one of them is chlamydia. Another one is trichomoniasis. Another one is candidiasis, what most of you call candida. Then another one is bacterial vaginosis. Yes, there are several others, but these are the commonest and the main. Now, how will you differentiate these diseases? It is quite hard for you to differentiate that this is chlamydia, this is trichomoniasis, but there are several things you can look at. And number one is the smell, for example. If it's bacterial vaginosis, usually the smell is fishy. There is that fishy smell you can get, and maybe it can try to show you that it is a bacterial vaginosis. Then for candidiasis, the discharge is pure white. It's like curdled milk. It's white, and there is usually itching of your private parts. So if you have a white discharge, it's like curdled milk coupled with genital itching, then it is likely to be vaginal candidiasis, or what most of you call candida. Then for trichomoniasis, the discharge is usually green. it's green, and for chlamydia it is usually yellow. However, in some cases of chlamydia, when it is not treated and stays there for long, it can change to green, but it starts as a yellow or a creamy discharge. Now, these are the likely causes of your vaginal discharge. Now, what you're supposed to do is to go and take treatment, because Gloria is saying that she has taken several medicines with no change. She has taken pessaries, the medicines for inserting down. She has taken several tablets, and she still gets this discharge. Now, what you're supposed to do is to go and do a test we call HVS. HVS is a high vaginal swab. We get something like a cotton or anything, and then we put it, we insert it into your V, and we pick a small sample at the higher centers of your vagina. Then we take that sample to the laboratory and analyze it. When you analyze that sample, you're able to come out and say the cause of this discharge is particularly this. Because what most health workers or what most doctors do, when you come with a discharge, they will combine medicines. They will combine the antibiotic, they combine the antifungal, they combine whatever medicines, including antisteroids, because the person is not sure of what they are treating. Because we've said there are several causes, and some of the causes are fungal in origin, others are bacterial in origin. You can even find viral causes. So now, if you combine all those medicines, of course, that's how people panel beat around and treat the infection. But to treat it clearly, especially in this case where it is persisting after taking several antibiotics, it means that this person should really do a high vaginal swab and all do a culture and sensitivity. What do we mean by culture and sensitivity? After taking your sample, we take it to the laboratory and grow it in a container. We put some elements that provide a conducive environment. In case there is any of the bacteria or any of the germs or any of the organisms in that sample, that organism will start growing. So this laboratory technician or the laboratory person is going to observe the growth of this organism. And by observing the growth of this organism, we'll be able to tell that no, the way this organism is growing, it is a trichomoniasis. The way this organism is growing, it's a chlamydia or it's something else. And now, after observing its growth, then the next is to start applying some medicines. What we do, we look at these organisms, the several bacteria that have grown, or the several germs that have grown, and then we start feeding them. We start giving them different antibiotics, different antifungals, and we find the clearing rate. We find how much has this medicine cleared of this of this germ. So by looking at that, you're able to know that this time, this chlamydia cannot be treated by doxycycline. Therefore, I need to change another drug, probably clindamycin or azithromycin will treat this germ. We do that in such cases of reoccurrence, whereby you are treating and you're not getting cure. I have seen several people, someone treats a discharge from January up to January. A discharge comes, they treat, then after 1 month, it again comes back like that. Then it means you should go and do an HVS or culture and sensitivity to find the exact cause of this discharge. Number 2, to get the medicine that will clear that bacteria or that germ away. Secondly, what you need to do is to also visit your behavior, because when you look at these infections we are talking about, most of them are STIs. They are sexually transmitted. And therefore, if you get treatment and your partner is not treated, then there are several high chances that you will get reinfected by the other untreated partner of yours. Because with these diseases, you can, both of you, the couple can have, both people can have these diseases, but one of them shows the signs and symptoms. So the other person who has not shown signs and symptoms will not take the medicines, because for them they think they are not sick. But at the end of the day, they are having the disease, though they are not having the signs and symptoms. When you treat, yours will get fine. Of course, the disease will be wiped out, but the other gender will now bring the disease again to you and you'll get reinfected. Something else I also tell my people, especially those I treat for recurrent discharges, I tell them to develop a good hygiene. So there is this tendency of you ladies washing your pants and then take them to the bedroom for drying. I mean, how will they dry? They will dry by moisture, and moisture will not kill the germs if they are present in your pant. So what we usually advise is for ladies to dry their pants in the sunlight. Put them outside in the sunlight. They get exposed to sunlight so that some of the germs can be killed from there. And if you cannot put them in the sunlight, then iron them. Use a flat iron to kill some of those germs. And some of you have drying machines. It's fine. You can put your undies, your underpants into the drying machine, because the drying machine actually has higher temperatures which can kill the germs if they are present. And therefore, my last advice here for you is that do not moisture dry your undies. Put them in the sunlight, or dry them in the machine, or else you can use a flat iron. If you're watching this channel for the very first time, don't forget, don't leave without subscribing, and also press the notification bell. And for those of you who would like to have a private chat with me, to have an online consultation privately, go to my website www.druthman.com and make an appointment. Find us on all our social media platforms. Ask Dr. Uthman. Ask any question. We shall be right there to answer you. Please share our videos.
Ask Dr. Uthman on Sawa Wall.